So welcome everybody, good afternoon. Welcome to this webinar, Daily Movement in Tai Chi, 3 Keys to Improving Balance, Walking, and Running. And I'm very excited today. I have my friend and my colleague, Dr. Osar, with me to really take this subject on. As I was just saying to the group ahead of time, it's a very important subject. We need to be concerned with balance for our clients. So Dr. Osar is internationally known. He is a speaker all over the world. He is so fun to watch in person. If you have ever had the chance to watch him, he has tremendous energy, but what really surpasses that energy is his knowledge. And I'm so glad that you're here today, Dr. Osar, to join with us. I'm going to let you do the rest of your introduction. You let the people know what you want them to know, and I'm going to let you take over the screen.
Awesome. Thank you so much, Dianne. It's such a pleasure to be here and to share with your audience and to also give them a sneak peek preview of what you and I will be talking about later on this year, I should say, in the fall. So let me share the screen so you guys can see my screen. And let me just make sure that everybody can see my screen. Let me blow this up. Everything, you can see my screen okay, Dianne?
Yes, indeed. Thank you.
Perfect. Thank you so much. So this talk is about posture, balance, and walking. And you may have seen the title also here, Brain, Balance, and Barefoot. And we'll talk about that definitely as part of this talk of posture, balance, and walking. And as I mentioned, my name is Dr. Osar. I work in Chicago, Illinois with my wife and our team of Chicago Integrative Movement Specialists. And we really work with the everyday person. The older clientele is our clientele who we work with. And yes, we see athletes, we see a lot of professional dancers, but who we work with the most are individuals age 50 and older to provide them real strategies for posture, for movement, for life. And as Dianne said, one of the components that we really stress to our clients is the importance and the link between posture, balance, and walking. We also have an education company called the Institute for Integrative Health and Fitness Education, and we do certifications. One of them is the Integrative Corrective Exercise Instructor Program, as well as the Integrative Movement Specialist Program. Both of these are intensive programs to help train health and fitness professionals to understand how to incorporate some simple assessments, corrective exercises, and the most effective fundamental movement patterns to help their clients move better, feel better, and perform at their greatest level. Now, the types of clients we see in our clinic, as I said, are the clientele that are age 50 and older. And this is a picture of my friend Debbie, and she came to me as a patient several years ago. And Debbie is a typical 69-year-old female. She still works full-time. She's a psychologist. And she presented with atrial fib issues. She has balance issues, especially when she turns her head. She's got bilateral joint replacements in her hips, and she's had her big toe fused. She deals with chronic musculoskeletal pain as well as joint issues. So she's very similar to a lot of the clients you'll see as a health and fitness professional. And if you're joining on as a general population individual, then you maybe experience some of these same things. Now, I just want to share with you what she said to me recently. She said, "Hey, I just finished my exercise. By the way, I'm feeling stronger every day. I'm loving it and inspired to keep at it." And I asked her if I could share this with the audience, and she said, "Yes, please do." So this is the type of client we see, and this is what is commonly going to be seen in your gym facility, in your clinic, or experienced as an older individual. But we're here to say that it doesn't have to be this way. A lot of our clients will present with multiple issues. However, we believe that all clients have the ability, all individuals have the ability to change. And that's really what we want to share with you here today in this webinar, are strategies that you can use and implement to create changes in posture, balance, and movement and make them happen right away. So the goals of today are to talk about the ABCs of walking and running, a little bit about the anatomy, a little bit about the biomechanics, and a little bit of the motor control. But more important, to discuss why walking and running is so important and what constitutes optimal and efficient walking and running. And to discuss the integrative movement system, the system that my wife and I came up with to help our own clients address their posture, their movement, their walking, and their balance. And then to talk about the link between balance, breath, and the benefits of being barefoot if your client can be barefoot. So our goal is to help you be extraordinary at what you do with your clients so that you help empower more individuals about the importance and the ability that they have the ability to feel better, move better, and accomplish their health and fitness goals. So to me, longevity and independence is all about how well the individual is able to hold their posture, balance, and walk, because that's what we need to have longevity and independence, to actually create that quality of life that everyone is looking to have. And Dianne and I were just presenting at the Functional Aging Summit, and the senior games were out there where individuals over the age of 50, so people anywhere from the age of 50 to even individuals over the age of 100 were competing in the senior games. And it was so inspiring to me to hear some of these stories of these individuals, because I would have thought, hey, these people are old, they don't need to exercise, or I should say not exercise, but compete at a high level, like actually compete, like run and sprint and jump and throw and things like that. And people at the age of 100 were doing incredible things. And it was very, very inspiring to me. And I was very excited to bring that information back to my clients who feel like that they've sort of given up, that they're too old. So it's really a good testament to what you can do and what you're capable of when you put your mind to it and you have the right strategy for posture, for movement, and for balance. So what allows us to have what we refer to as optimal and efficient walking and running? And I want to find some examples of what optimal and efficient walking and running were, and this is what I came up with. If you look at this picture of my niece right here, she's about 6 months at the time I took this picture, you can see she's got perfect alignment of her rib cage over top her pelvis. She's got perfect alignment of her hip, knee, ankle, and foot before she's about to upright herself or get herself up into the right position. Because her brain, her nervous system knows, we talked about the importance of, or the involvement or the integration of the brain in this model. The important thing is the brain is always involved with setting up posture, balance, and movement, even at 6 months of age. And in fact, the brain is really what starts us understanding and being able to create optimal balance, posture, and movement. Now, I want you to take a look at these women in the middle two images here, walking with massive loads on top of their head. These women here, you see them walking with large loads of stones. You see these women carrying massive barrels of water, and this woman even has a baby on her back. And what you'll see or appreciate, what I want you to appreciate from that, is the fact that these women are skinny little women. They don't lift weights, so it's not like they're what our definition of what strong is, but they have the ability to balance these massive loads, because that is the most efficient way to carry large objects for long periods of time and long distances. This is the best and most optimal way to carry large objects. So what allows them to do that? Well, they do three things very well. They align, they put their joints in the best position for loading, similar to what my niece was doing back here. They breathe very well. We'll talk about the importance of breathing as we go along. And they control their body very well. They're not bracing, they're not gripping, they're not trying to hold themselves as tight as possible, but they have the right amount of muscular effort. And as you can see, these women are real skinny, as I talked about, that it's not about muscling your movement or muscling posture. We want to create that optimal and efficient posture and movement, and it's not just about squeezing muscles as tightly as possible. And then the last image is an image of African runners. And I picked this image also because it really shows us what individuals can do when they really develop their alignment, their breathing, their control, when they can really create this optimal and efficient strategy for walking and running. And if you think about, or you've ever watched a marathon, and you watch these African runners, or the real efficient runners, the runners that tend to finish towards the front of the pack, they run very well. And it's a very beautiful sort of illustration of what optimal posture and movement looks like. And if you were to use some words to describe what these individuals look like when they run, you'd probably use the words, it looks like they're running effortlessly. It doesn't look like they're trying to muscle things or putting a lot of effort in. They almost seem like they're floating across the ground. Now, if you compare that to somebody that's not very optimal or efficient when they're running, and this is no disrespect to anybody when they run, even if you look at the way I run, it's not very optimal or efficient as it could be. What you'll see is someone like myself, I'm using a lot more effort than these individuals use. My footsteps don't sound as light on the ground as these runners do. And it doesn't look as effortless by any means as these individuals do. So what they do very well to create the optimal and efficient running strategy is they do three things very well. They align, they breathe, they control. So we set up alignment, breathing, and control when we were infants. All of us did that. We carried it through our life. We should carry it through our life, I should say. And then if we develop it appropriately, we can express that in activities of everyday life, whether we're carrying large loads on top of our heads, whether we're performing in sports, or if we're just doing our daily activities of everyday life. So I want to talk about the three things that help create posture and balance, and that takes us to our conversation of what creates optimal walking, and this takes us to the GAIT cycle. GAIT just means walking, and we're going to look at one GAIT cycle. So from the time the right heel hits the ground, for example, till the next time that right heel hits the ground, a series of events happens. We go from double leg support, so that means both legs, both feet are on the floor, to the point where about mid-stance, right about around here, will be in single leg support. So that's one leg is on the ground and one leg is swinging. And then to the time the next heel hits the ground, that's one GAIT cycle. And a lot of things are happening. Posture and balance are a big key to how efficiently and how optimally you'll go through a GAIT cycle during any given day. The average person should walk about 10,000 steps. The average American actually walks closer to 3,000 to 4,000 steps. But even if you're walking 3,000 to 4,000 steps, many of us are not doing it in the most optimal and efficient manner. So let's talk about what will create a more optimal and efficient GAIT cycle. So there's three things that control our center of mass, which is basically our body weight, our center, which in Tai Chi, and Dianne will discuss this a little bit further, the DANTIAN, the center of our body, which is basically right in front of our belly button, just a little bit below our belly button, right in front of our sacrum, is the center of mass when we're standing in the upright position. This is controlled by visual, our eyes, our vestibular system, our inner ear, the mechanism inside our inner ear, and our somatosensory system. Somato just means body. Sensory just means sensory, sensation of our body. So all the proprioceptors or receptors that are in the skin and the muscles, the fascia, the connective tissue, the joints, all our body is set up to help control the center of mass, our center of mass or dantian, over top our base of support, which is our feet, or for running, our 1 foot at each step. Now, the first thing we're going to talk about as it relates to center of mass over base of support is the head and neck and the righting reflex. And this is why the visual system is such an important component to posture, to balance. And I want you to compare these two images. This is one of my favorite pictures to use in my presentations because it really illustrates how our body is and should be set up for optimal alignment. And what you see with this child here is her head is perfectly positioned over top her rib cage, which is perfectly positioned over top her pelvis. So you see this nice, a straight line would come down through her ear, her shoulder, her spine, and through her pelvis and hip complex. Perfectly aligned, and she's looking down at her toy cell phone, which will very soon become a real cell phone. You see these kids now at 6 months of age, they can already figure out how to use a cell phone better than I can use it. Now, if you compare that to this gentleman to the right of your screen, you can see that he's what a typical patient over the age of 60 looks like. And you see a very different appearance. You see the head is forward, the rib cage is back, and the pelvis is relatively forward. So it's not aligned like this little child. And if you drew a straight line at any point of his body, so if you put it through his ear, it's going to fall way in front of his spine and way in front of his pelvis. If you put it through his spine, his upper back, the line will fall through his rib cage, but his head and pelvis will be forward of those points. So again, first, the righting reflex is off in many of us as we get older. But what's important about the righting reflex is it will help us maintain our eyes level to the horizon. And a lot of these things that we see with posture are really just the adjustments our nervous system has made to keep the eyes level to the horizon. So that means if our pelvis twists, it will twist our whole entire spine. Well, in order to keep the eyes level to the horizon, then somewhere else in the spine must twist, and somewhere else in the neck probably twist. Maybe something even in your foot will adjust to help keep those eyes level to the horizon. So the righting reflex is a big component that sets up posture and movement.
And I just wanted to interject, Evan. This is, you're talking about that riding reflex, and in Tai Chi, we talk about being suspended from the ceiling, being gently suspended, not a noose, but there's a point at the crown of your head that's called the Ba Hui point, and you imagine a nice silk string holding you, which allows that body to fall into that natural alignment, which is what you're talking about here.
Absolutely, and we'll demonstrate exactly that concept later on in this webinar, so thank you for bringing that up. The next thing that's important to posture and then ultimately movement and walking is rotation. And we refer to the rib cage over top the pelvis as the thoracolpelvic cylinder, or TPC, because if you look at my niece here, her rib cage over top her pelvis relatively looks like a cylinder. And it actually functions like a cylinder. The cylinder is created by the rib cage, the right and left ribs, and then the pelvis, which is essentially a ring. So it's basically a series of rings through your rib cage and a ring around your pelvis that forms this conceptual cylinder. Now, this cylinder must rotate to give us very efficient, optimal and efficient walking and ultimately posture, and to allow the eyes to stay level to the horizon, that riding reflex. So rotation helps improve our efficiency of walking. And if you can see by this individual here again, that the rib cage isn't aligned and stacked over top the rib cage. The rib cage isn't aligned and stacked over top the pelvis as it is in my niece here. So his rotation will not be as optimal as it could be because the cylinder is not aligned to its best ability. So rotation really comes around and through the thorax or the rib cage, and we need that aligned over top the pelvis so that we're using the right muscles, so that we're breathing, so that we're suspending, as Dianne talked about, to create this rotation and counter rotation to keep our body moving forward and not waddling sort of side to side. And that's one of the things we'll see in older individuals is they've lost the ability to rotate, so we tend to see more of a waddle side to side as they're walking because of the loss of this suspension or this alignment that we've been talking about, that being pulled up from the backside of your head sort of concept, and the lack of optimal rotation. And I'll show you a great exercise to bring this alignment back, which will also help to improve rotation. The third component to having optimal posture, balance, and walking are the feet, or the base of support. And what we're referring to here is the foot tripod. And if you can think of the foot tripod as having the most amount of weight underneath your foot, underneath the big toe, underneath the small toe, and at the heel. So it forms this conceptual tripod. And you can think of a chair tripod. The tripod chair generally will always be stable upon the ground. Now, if you think of a stool that has 4 legs, it always seems like that one leg is a little bit short, and that's why we think of the foot more like a tripod and less like 4 points, because we want the foot balanced between those 3 points, underneath the big toe, small toe, and heel, and then the ankle, shin, and thigh bone, or the tibia and the thigh bone, form a structure over top the foot tripod. So when we're loading the foot, when our foot is on the ground and we're either standing on the foot or stepping forward, or if we're loading it during squatting or lunging, we want the foot to be balanced on these 3 points, and we want the foot to essentially get longer and wider when we load it. So the foot should get slightly longer and slightly wider as we're loading the foot.
And I wanted to comment again. I'm sorry, Evan, but
no, it's okay. No, go ahead.
As I'm watching this, and this is how we talk in Tai Chi too, of being rooted and grounded and feeling that energy from the ground through your feet. But when you think about those 3 points, it also allows you to be just a little bit more mobile. If you were, I try to let my students, when I talk about being rooted and grounded, I say you're not glued to the ground. That's not what I'm talking about. You're fluid with the ground, and those 3 points allow you to be fluid and to move, which is where we really want people to be balanced, is in movement.
Correct, exactly. And exactly like you said, with mobility of the foot, we don't want the foot gripped down on the ground because a lot of people may be supported upon their foot tripod, but the foot is sort of like a block. It's not moving. So exactly as you said, Diane, we don't want the foot glued to the ground. We want it to be supported on this tripod and then still be able to move between the different points of the foot and still keep the entire foot on the ground.
Yeah.
Awesome. Thank you. So now that we understand a little bit about what creates optimal posture, balance, and walking, where do most issues occur if we're talking about walking? So remember I mentioned earlier that when we're walking, we go from 2 leg support or double leg support to single leg support when you come around this position of gait, and then we'll move as the left leg comes forward. In this example here, we'll go back to 2 leg support. So we're alternating between 2 leg support to single leg support. Where do most issues occur? By the time the person puts a heel down to when they become foot flat to when they start to push off until the next time that foot comes down, where do most of the issues occur? Well, they happen to occur right where you move into single leg stance. And that's all about, again, that posture, the balance, that alignment and control that we need when we move from those 2 leg support, from 2 leg support onto single leg support. So what we're going to do in the rest of this webinar is talk about now, how do we, 1, assess, 2, how do we address, and then 3, how do we progress so that our clients have more optimal and efficient ability to get into single leg stance and control their alignment, control their rotation, and control their foot or base of support. So one of the things that tends to happen is our clients will go through what's technically called Trendelenburg's gait, but don't worry about the name of that. It's when the hip kicks out to the side, and that's often attributed to glute medius weakness. And we'll talk about that more in our certification course. However, it's not glute medius weakness alone because, first of all, one muscle rarely ever causes a problem. But remember that the things that create optimal balance and support is not just the muscles around the hip, it's also what's happening up here at the head and neck and the eyes, the writing reflex. It's also what's happening through the thoracolpelvic cylinder, the ability to align and control that, and it's also what's happening down here at the ankle and foot complex. Now, some clients will not demonstrate this when they're walking. They'll demonstrate more that waddle sort of walking pattern, and that's what happens to most of our older clients, because what this client is trying to do is when they stand on single leg, they start to move their body over top that foot so that they feel more stable, and they are more stable in that position. It's not as optimal or as efficient as it can be, but it becomes a more optimal way to get onto single leg stance. And if you start to watch your older clients or watch yourself, have somebody videotape you walk, if you're an older individual, a lot of us will start to create this waddling or side to side sort of shuffling gait because we've lost that ability to rotate. And that's what I was talking about earlier. The importance of rotation is when you lose the ability to rotate, you start having to move more through the frontal plane or create that side to side waddle. Now, for many of our clients that are running, what a lot of this will translate into also is the inability to control the hip, knee, ankle, and foot in a straight line. So you start to see these alterations in strategy when they start to get into single leg stance. You see the pelvis here in this runner kick out to the side. You see the knee start to go into more valgus position. And you see the foot start to turn out. And these are all signs, all compensatory signs that the individual has developed a non-optimal and inefficient alignment and control strategy. The posture, the balance, and ultimately now the movement strategy is off because of one of these issues that we've talked about. And that's oftentimes where clients will develop knee pain and or hip problems or low back problems as well. And that's oftentimes what we see in our clinic with our older clients, or when clients start to get into exercise programs where they start to want to walk their 10,000 steps or start running and start challenging themselves and doing a 5K, and they develop knee problems or back problems. It's because of these non-optimal and inefficient alignment and control strategies. So what's the best approach? The most important thing you can do are to, number one, assess your client. You have to create an assessment process so you know what's going on with your client, and you have a way of determining whether what you're doing is working or not. You want to address what's going on, and I'll show you a very simple assessment and how to address that through 3 simple corrective exercises. And then you also need to know how to appropriately progress your client so you're not having them do exercises that are too advanced, where that way they're compromising their alignment, their breathing, their control, or going back into their compensatory type of strategy. And that's really where the integrated movement system is so valuable in helping our clients and our patients create a more optimal and efficient posture and movement strategy. And this is a system that we've taught to thousands of health and fitness professionals across the world. Again, we're going to assess to determine the client's current strategy. We're going to address it using the corrective exercises, and then we'll progress the client as we train the fundamental movement patterns. Now, phase one of the integrated movement system is the assessment process. And this is where you're going to identify your client's non-optimal and inefficient posture and movement strategy. So we're going to take them through assessments. I'm going to show you a very simple assessment later on in the webinar. However, you would take them through posture, just look at their overall alignment, how well they squat or load their lower extremity, can they align their hip, knee, ankle, and foot, how well does their foot react to the ground, how do they balance, how do they basically balance on one leg. And you can also progress into a step test where you have them take a step and then balance on single leg to see how they dynamically control their balance. You're going to look at things like breathing, and you can also use common balance tests like the timed up and go, where you have a client sit in a chair, stand up, walk. I believe I forget how long the actual distance is, but you have them stand up out of a chair, walk, come back, and see how fast they can get up, get back to the chair, and then you compare it to before and after. So again, just different examples of assessments you can use. We're going to look at most specifically the balance test just as a simple assessment for this webinar purposes. Okay, the first thing we want to look at with posture is essentially look at your TPC, or that thoracolpelvic cylinder alignment. How well is the ribcage aligned over top of the pelvis? How well is the lower extremity aligned? And where is the center of mass over the base of support? So COM, center of mass, over the base of support. The center of mass is, as I mentioned, behind and below the belly button, just in front of the sacrum. So somewhere around where the pointer, hopefully you can see the pointer on your screen, is pointing right there. And we want the center of mass essentially right over top of the base of support or the feet. And in this client, it is. And the rib cage, her rib cage is relatively well aligned over top her pelvis. So again, we want the center of mass, the thoracolpelvic cylinder, over top the base of support or the feet. And we want the thoracolpelvic cylinder aligned, so the rib cage over top of the pelvis. And we also want the individual to be supported upon their foot tripod. So if you can, have your client take their shoes off so you can see exactly what the foot is doing in reaction to the ground. Because a lot of times, the client's shoes are actually inhibiting them from getting the entire foot flat on the ground. So if you can, if your client doesn't have orthotics, or they haven't been prescribed different types of shoe wear, take their shoes off and look at their foot on the ground so you can actually see where the foot is and where the support is on their foot. Now, if your client does have orthotics or has been told to wear orthotics or supportive shoes, then I would still try to at least assess their feet without shoes on. However, you'll still do the same things we're talking about. However, realize that you'll have their shoes on, but they'll still try to create the foot tripod in their shoe and with the supports. Not as easy as barefoot is, but again, you'll still use the same concepts as we discussed through the rest of this webinar. So one of the things you'll see commonly in clients is their alignment is off. And I want you to notice two different variations of rib cages not being stacked in a line over top of the pelvis. The gentleman on the left is more typical of what you'll see in your older clients. The woman on the right is more typical of what you'll see in some of your younger clients, especially the athletic population, clients that work out, clients that have done gymnastics or a lot of yoga or Pilates or fitness professionals. So if you look at this gentleman, where is his rib cage relative to his pelvis? So imagine his pelvis is right about where the pointer is down here, and then his rib cage is right about here where the pointer is. And you can see in this individual, his rib cage is positioned behind his pelvis, and that's very typical of older clients over the age of 60 for sure, because a lot of them have not done a lot of postural sort of awareness, or they haven't had postural training, so they sort of have collapsed down where their rib cage has moved behind their pelvis. Now, if you see this woman to the right of your screen, her rib cage is also behind her pelvis, or her pelvis is in front of her rib cage. It's behind for a different reason though. This gentleman has sort of just collapsed into this posture. This woman has actually extended herself into this posture. And as I mentioned, this is a very typical posture you'll see in people that have been trained in gymnastics, which she is a former gymnast, as well as yoga, Pilates, as well as fitness professionals, because we have all been taught in the fitness world, in the health and fitness worlds, both worlds, we've been taught to lift our chest up and squeeze down and back with our shoulder blades, hence the reason you get the ribcage position behind the pelvis. Again, this is more of an active position. This is more of a passive position. This is actually harder to change because this is such an ingrained pattern into the nervous system of so many people, because they've taught themselves to lift up and back, and they've trained these muscles to hold themselves in that position. This is challenging. This gentleman is challenging to change because he's had structural changes at this point. She's generally young enough, this woman to the right, she's generally young enough that you can still change her posture. It's just harder because she's hardwired this into her nervous system. This gentleman will be more challenging to change from the standpoint of he may have structural changes that prohibit him or keep him from getting himself into that posture. He may have bony changes. He may have soft tissue changes that won't allow him to get into, quote unquote, the best or most optimal posture. However, even these clients, no matter how old they are, how long they've been like this, they can change. The great thing about working with these clients is you don't have to unlearn anything. They've just sort of collapsed into this position. You don't really have to teach them something different. You just have to teach them something. So that's why where the cue of think of a string from the back of your head works so well for these individuals, because they haven't done any postural training. So that cue actually works very well. And I'll show you one of my clients later on that's demonstrating the cue and the exercise we use for them. Like I said, these clients are harder to change just because they're more resistant to change. They've been taught and hardwired this into their body from what they've learned to do. So again, some of them are resistant to changing, so it's harder from a sort of philosophy standpoint. But again, anyone can change it at any age. I never qualify somebody when they first come in and see me. I just give them the information and then give them the strategies.
And part of the beauty of integrating Tai Chi, which we're going to talk about, and we're so excited about how this all fits in with Tai Chi, is allowing both of these individuals to relax.
Exactly.
And you might feel like the gentleman on the left is too relaxed, but that actually, if you let him relax and allow that alignment to happen, it does. And he's not even thinking about alignment necessarily. He's really thinking about how should I be standing relaxed for Tai Chi and have my columns in the right place. I talk about not being ramrod straight, not military straight, which is like a young lady, where they have their chest lifted. Whereas I want my columns all in alignment in Tai Chi. And when we talk about in just a different kind of language, that allows even the athletic types to relax into that proper posture. So that's part of the beauty of Tai Chi as well.
Exactly. And I love the idea of column, because we talked about this cylinder, and column and cylinder is basically the rib cage stacked over top the pelvis. And that's what we're trying to optimize, is how well can we stack those columns or that cylinder, the rib cage over top the pelvis, and then also in relationship to the lower extremities.
Absolutely.
So common postures, as we talked about, are your older clients. A lot of them will be in hyperkyphosis, which is this gentleman to the left, and that's where the rib cage is behind the pelvis. A lot of your younger clients, your new moms, they'll be in this sort of sway back posture here with again, the rib cage is behind the pelvis. Our goal is to help our clients create the best opportunity to get that rib cage stacked above the pelvis, or to stack the column, or to stack that cylinder, as we've been discussing. Okay, so our next assessment is a single leg stance test, and this is a great way just to see how well your client aligns and controls their thoracopelvic cylinder, as well as their body weight, their center of mass over top their foot. You can also have them step to take a single leg stance as well for clients that standing on single leg is actually pretty simple, and we'll demonstrate that later on in the webinar. So once you've assessed your client and you've identified that, okay, they have some balance issues, or maybe they have some other issues as a squat or lunge or get up and go during the get up and go test, now you want to move into phase 2 of the integrative movement system, and that's the address phase. And the address phase is where you use your corrective exercise strategy to take your clients from where they want to get to, address their needs, and progress them to where they want to go. And this is where we use our release work, our activation work, and our education. And that's where the integrative movement system was developed to help our clients create a more optimal and efficient posture and movement strategy. And it's based around 3 simple principles. Where do we get our principles for posture and movement? We get it from child development. The strategy that all of us went through from the time my little niece was born to the time she is here at 8 years old, and we'll see her in a couple weeks, she just turned 9. She went through a certain series of positions, patterns, and progressions. And we all went through these exact same positions, patterns, and progressions to help align our rib cage over top of the pelvis. And I want you to appreciate where the rib cage and pelvis is aligned in the top image and where her rib cage and pelvis is in the bottom image. She's learning in these positions on her back, on her side, in the plank position, in the quadruped position, when she's rolling, when she's crawling. She's learning how to align and control the rib cage over top the pelvis. She's learning how to breathe to set up her core muscles to create that more optimal and efficient strategy for uprightness, getting herself into the upright position, for controlling that hip, knee, ankle, and foot complex, for controlling that center of mass over top her base of support. So alignment, breathing, and control places the joints in the best position for loading, and it also creates the most optimal and efficient strategy for posture, for balance, for walking. And that's ultimately what gives us the ability to perform at our greatest level. And this is ultimately the strategy you'll use, the ABCs, to help your client reestablish their most optimal and their most efficient posture, movement, and balance strategy. Now, the first step of the integrated movement system is release. So I'm going to demonstrate in a couple minutes now how you can use your hands to actually release the foot, but you can also use your tools. A tennis ball works very well. A lacrosse ball works very well. A Yamana, if you're familiar with that device, works very well. Because ultimately, as I mentioned, we want to create that foot tripod so the foot is supported upon or underneath the big toe, small toe, and heel, and the toes are long, and the foot is reactive to the ground. So we have to do release work around the foot, around the calves, to allow that to happen in a lot of our clients that have lost that awareness and have lost that control, and they've developed maybe scrunched toes like those claw toes or hammer toes or bunions. Those are all signs that your client is not using their foot in their most optimal and efficient manner. Once we've released, now we want to activate certain muscles. And I'm going to show you how you can actually release and activate at the same time, because you want to turn on. You want to make sure the right muscles are working to help you support the foot in the right position. And all the muscles around the thoracolpelvic cylinder, that cylinder, are also working. So I'll show you how to do that around the foot first, and then I'll show you how to integrate that into some corrective exercise patterns. So essentially, this is the integrated movement system corrective exercise strategy. You release, as we just talked about. You'll also have to release some of the gastrocnemius and soleus, so you may have to get up into the calf, or I should say you will want to get up into the calf to release these muscles, the long toe flexors. You're going to activate the intrinsic muscles of the foot, and we'll do that with our hands. I'll show you how to do that in a moment. And then we're going to educate using our cues to lengthen and widen the foot, to reach your toes long. And we talk about novelty, or I should say, when we talk about brain health, we talk about novelty of position and movement. One of the novel things about Tai Chi, for sure, Dianne can address this as well, but also with our approach, is the cues we use bring our clients awareness to different parts of their body. So one, we're creating awareness. 2, we're increasing proprioception to different areas of the body. And 3, we're actually improving brain health because we're giving the individual a novel experience. If your client is used to having their toes clawed, and now you're teaching them, hey, I want your toes to go long, and you're actually teaching them or bringing the awareness around getting the toes long, that's a novel experience to the brain. That actually is good for brain health. So the more novelty you can bring to your exercise by bringing more awareness to new ways of moving, that actually increases neuroplasticity and that brain health that so many of our clients, we all need that as well. We'll also do the wall plank. And wall plank is one of our most favorite posture exercises, because in this position, you can notice that it allows me to get long. It allows me to think long, that string from the back of my head pulling towards the ceiling. It allows me to stack and align that thoracolpelvic cylinder. It will also allow me to create three-dimensional breathing in the upright position. So for your clients that can't get down to the floor, and you also, even if your clients can get down to the floor and you teach them breathing, you still want to incorporate breathing in the upright position. The wall plank position is an excellent position to teach posture, to teach them how to create three-dimensional breathing, and then we'll also introduce single leg stance from this position, and I'll demonstrate how to do that as well. The third exercise I'll demonstrate is the step out pattern, and this is a great way to transition your clients into single leg stance and really develop the ability to align and control the thoracolpelvic cylinder, to align and control the hip, knee, ankle, and foot complex, set up the foot tripod, and then balance on a single leg as you step out and tap your toe and then bring that leg in. So the work is being done by the stationary leg, not by the moving leg. So the goal is to align the thoracolpelvic cylinder and lower extremity on the stance side, to anteriorly rotate the pelvis to create that hip hinge, to preload, to pre-activate the glutes and posterior chain, and then to tap that right foot or the moving leg out to the side. So I just want to show you what this all looks like together. So the first thing you want to do is you're going to assess, and you have your client do a self-assessment. And then we'll do foot activation. So here we're going to do an assessment and address. So this is me out at my sister's place here in Houston, Texas, and I'm just doing a self-assessment. So one thing I want you to do as you're listening to this is, if you're wearing shoes, pop your shoes off if you can, if you're not driving, or hopefully you're not driving as you're watching this. But if you're sitting at home in your office, take your shoes off and just stand up and feel your feet on the floor. And just get a sense of where your feet are on the floor, where the weight is on each foot. Is the weight on the inside or outside? Is it on the inside of one and on the outside of the other? Just get a sense of where your weight is on each foot. And then what I want you to do then is just bring one leg off the floor. So just stand on one leg, hold your balance, and then put it back down. And then stand on the other side, hold your balance, and then put your foot back down. Now do it one more time and get a sense of, is one foot or one leg harder to stand on? And generally, everyone has a side that's a little bit more challenging to stand on. And generally, in that foot, generally speaking, not all the time, it's a foot where you're more on the outside of your foot. The harder balance side is generally the side where you're more on the outside of your foot. Now, some people can have the opposite, where it's more on the foot where they're more flattened down to the floor, but just take notice of which side is more challenging, because next we're going to activate the muscles of the feet so that we get a better foot tripod on that side. So what you're going to do is take the foot that you had more trouble standing on, that side, and now we're going to activate and wake up the muscles of the foot. So my left side is harder to stand on, so I'm going to activate and just work on the muscles of the foot. We're going to start with the muscles of the arch of the foot. And you see me pointing to that area. And now I'm just going to dig my thumbs into the arch of the foot. And I'm going a little faster than I would if I was doing this for real, but just for the purposes of this webinar. You're going to work up the inside arch of the foot. The only area of the foot you never want to rub underneath is underneath the big toe. Don't rub underneath there. There's two little sesamoid bones there. You don't want to rub on them, but you can work right below the big toe, just not the ball of the foot. Now, very gently traction your big toe, and then you repeat on the opposite side of your foot. And like I said, I'm going a little bit faster than I would if I was doing this for real, but I'm just demonstrating this on the video. So we're going to work the outside arch of the foot, and if you're using a ball, which for most of your clients you will be using a ball, just place the foot over the ball in these areas. And now what I'm doing here is I'm stretching the toes out, because remember, we want the foot to go longer and wider. So I'm spreading the toes out, allowing the foot to spread out, because that's what I want the foot to do eventually. So if your foot's over the ball, basically what you're going to do is you're going to spread your foot out over the ball and just allow the toes to stretch over the ball. Now, once you've done that, go back and stand up now. So if you've done that as you're watching this video, go back and stand on your 2 feet. Feel the pressure of your 2 feet, and where is your brain more attentive to now? Obviously the foot you just worked. Now recheck your balance. As you can see, my stance on the left side is more solid. I can actually feel my foot on the ground now. It's much more active. Now from there, we want to work on taking this into the upright position. So our second corrective exercise to improve posture, balance, and walking is a wall plank with hip flexion. So you're going to see me set up that long spine position. We're always going to begin with those ABCs: align, breathe, and control. I'm going to put my forearms down on the wall. My thumbs are about eye level here, and I'm gonna make sure that my spine is long, and I just rotate my head side to side just to make sure my neck isn't tight. Now I'm gonna breathe 3 breaths into my cylinder, into that thoraco-pelvic cylinder, making sure my breath goes top to bottom, side to side, and front to back. And now I'm going into hip flexion. So I'm teaching myself now to align and control my thoraco-pelvic cylinder, and now go into hip flexion. So that way I'm teaching myself how to get onto single leg stance and maintain that thoraco-pelvic cylinder alignment. Excellent exercise to train the GAIT cycle, or that hip flexion during the GAIT cycle or when walking. The third exercise are the step outs. Again, we're going to start with the ABCs: align, breathe, control, and now hinge. You want anterior pelvic rotation to load up that posterior hip, and now we're going to maintain the ABCs, maintain hip alignment, hip, knee, ankle, and foot alignment as we step out, and control the pelvis. There should be no motion of the pelvis through this patterning. Start with the ABCs again: align, breathe, control. Go into your hip hinge, step out to the side, maintain alignment of the hip, knee, ankle, and foot complex. Great way to activate the glutes, great way to load the posterior chain, take pressure off the knee, teach a client how to work on single leg stability. Now, that step out pattern also becomes a great way to progress them to single leg stance. And this is how you progress your client from the step out to single leg stance. So essentially, we're going into the step out position again. Align, breathe, and control. So hinge, set your client up, step out, bring it back in, lift the foot off. Now you go into single leg stance. Great way to get your clients to learn how to own that single leg position, to make sure that they use the glutes, they're aligning, controlling the hip, knee, ankle, and foot, and they're using the glutes through that process. And again, for our clients that this is even still too challenging for them, we'll just have them lightly put their hands up against the wall with fingertips for a little bit of extra support, so they still can perform this pattern and still get the benefits of the thoraco-pelvic cylinder being aligned, the hip, knee, ankle, and foot also being aligned. Great series of 3 corrective exercises to improve posture, balance, and movement. And now all you want to do is take these concepts: the foot tripod, the long spine, the thoraco-pelvic cylinder alignment, as well as those ABCs, alignment, breathing, and control, and integrate them into the fundamental movement patterns. So again, you can take your clients through lunging if they don't have knee problems. Lunging are great patterns because you can perform them in multiple planes. You can load them up. You can also go lunging to stepping, or lunging to stepping to single leg stance. So easy to progress these patterns and make them more challenging to improve posture, to improve balance, to improve walking. Carrying, walking, and balance patterns are great patterns. So again, walking patterns using kettlebells, dumbbells, medicine balls are all great patterns. Again, you can do unilateral carries to work on more control of that frontal plane motion. So if your client is one of those clients that goes waddling, so once you've done your corrective exercises, have them, if they side bend their body to their left, put the kettlebell in their left hand, which will help keep them more upright. So you want to load them into their side of that they would normally go to, so that way they have to use their opposite side to keep themselves a little bit more upright. So just different ways you can use carry, walking, and balance patterns to progress your clients. Now, this is my client, Ellis. So I'll show you how to put this together. He's a 79-year-old gentleman. He's had 3 strokes, type 2 diabetes, so he's got diabetic neuropathy. He's got spinal stenosis, so he's got neuropathy from that as well. And he's got a frozen shoulder. This is how you integrate the breath, balance, and also incorporate brain health for someone like Ellis. So I have him in the wall plank position, and what I have him doing here is the hip flexion. So I'm cueing him to keep the spine long, and you see him actually tuck his chin right there. So he's cued to stay long as he goes through hip flexion. So a great pattern for your older clients to teach them how to get long. The wall plank is really a great pattern for doing that. Again, if they can't have their forearms flat against the wall, they can always just have hands against the wall as well. The next pattern we're going to have Ellis do after the wall plank with hip flexion is a step out with alternating arm step out, I should say. So what we're going to have him do here is, because he can't do the step outs because of his balance issues, we have him doing a step forward, step out with these suspension straps. You see him, he's sort of thinking about it. So this becomes a little bit of a brain challenge for him as we're working on alternating arm and leg step outs. So again, It's not hard for probably you and I should say it's not hard for you and I, but it is challenging for some of your older clients. Now we start working on rotation as well. So I put him on a balance pad, which will still allow him to keep his foot flat on the floor. It allows him to work on keeping his vision straight forward and allows him to rotate side to side. So that way we're working on now, can you rotate your trunk while still maintaining your vision going straight forward and still controlling, aligning and controlling the hip, knee, ankle, and foot, and maintaining alignment of the thoracolpelvic cylinder. So just different ways to incorporate these concepts, the ABCs, the vision, the brain health, and breathing into your balance, posture, balance, and movement progressions. So essentially, we've taken you through the integrative movement system for posture, movement, and for performance, as well as balance. You use your assessments to identify your client's non-optimal and inefficient strategies. It also gives you a place to go back to show your client, hey, look what you've done now compared to where you were when you first started this session or when you first started this exercise program. So you have something to compare it to, as well as show your client how well they've progressed. You use your corrective exercises to address what you found in your assessment. Your corrective exercise strategy is release what's tight and restricted, activate to increase neuromuscular activation and brain attention to that area. You also educate using the right cues, which will also, again, bring more of that brain involvement into your exercise program. And then you progress your client. You progress them using the ABCs. You integrate the ABCs in the fundamental movement patterns. And of course, you're going to use variety. You're going to use the right progressions with your clients. You're going to keep it challenging, keep it fun for your clients, so that way they improve their posture, their balance, and their ability to move, walk, run, and all the things that they functionally want to do for life and for health. So that brings us to the course that Dianne and I are doing on balance, walking, and longevity. It's the integrative movement system and the integration into the open the door to the Tai Chi system. It's a 2-day course that the two of us are doing this September in Dianne's studio in Denver, Colorado. Very excited. Day 1, we're going to go through assessments for posture, for breathing, for balance, some of the things I shared with you, and much more in that day 1 class. We're going to go through the corrective exercises I shared with you here, as well as some of the other exercises we'll use with our clients, including how do you train 3-dimensional breathing, so that way you get your clients to better align the rib cage over top of their pelvis, better suspend and keep that nice long spine position, and then how to progress and integrate these concepts into the functional movement program, or progressions, I should say, for walking, for balance, for performance. And then also, we're going to share with you, how do you market yourself? How do you get out there to your community and discuss this information? Because your industry, your area, your market, they need this information. Every place in the country, there probably isn't a place that doesn't need someone like you to bring this information to your community. So we'll share with you ideas of how to do that, and things that we've found have worked and things that Dianne has found that works as well. So very excited for this opportunity to, 1, work with Dianne, 2, learn Tai Chi, learn more about it personally for myself, selfishly for myself, and also to blend these 2 concepts of this ancient practice of Tai Chi and the modern concepts of what we know about posture, balance, and movement.
Well, and as we've discussed, and I'm very excited for anyone who comes to this workshop, you'll be able to learn more in depth of what Dr. Osar is talking about, how to help assess your clients, how to help to address those problems, and then how to progress them. All of that is, that gives your clients that immediate balance improvement, that immediate improvement in their movement pattern. And you saw with the foot, rubbing on the foot, just an immediate improvement, even in Evan's balance. And then as we looked at, because we understand that balance is not just a one-time thing. You don't just work on it once and then boom, you're fixed.
Right, exactly.
You have to keep working on it. You have to go through those progressions. And if you give them something like Tai Chi, if you incorporate these things into Tai Chi, this becomes their long-term habit of practicing these ABCs.
Mm-hmm.
Because the ABCs, alignment, breathing, and control, and Tai Chi are completely integrated. And that's why Dr. Osar and I are so excited about this because we realized as we talked and the more we talked that this becomes both immediate help to your clients and long-term help, which is why we wanted to put together the workshop for people to come experience all of that and then take it back to their community.
Absolutely.
And I have the actual workshops. I'm going to steal the screen at this point.
Okay, cool.
And what I'm going to do is bring up the actual workshop dates are on, let me get to, bring this to, there we go. Those actual workshop dates are September 20th and 21st. Like Dr. Osar was saying, we have day one that's going to be the corrective exercise, all of the more in depth of, if you were interested in what he was saying today, he's going to be able to give you more tools and you'll be able to take home immediately to help your clients. And then day two, you get to learn Tai Chi. And part of this workshop is the actual Tai Chi certification. So along with the cost of the certification, or along with the cost of the workshop, comes the certification. That's all part of the cost of the workshop. So you get up to 23 CECs. It's going to be a great weekend because we have lots of education for you. So that registration page is at taichisystem.com, live workshop registration. So it's taichisystem.com/live workshop registration /. You'll be able to see that. And we do, because you've joined us on this webinar today, we want to give you an early discount code. We're going to keep this discount code open for a week. The discount code is early, and that's why it's up there. All capitals, EARLY. You can use that and you get $100 off. We're doing this in my studio, and we only have space for 15 people. I already have a couple people who have signed up, even though this says 14. I want to have as many people as possible. However, I also want it to be as intimate as possible so that you get as much hands-on learning as you can. So we are going to limit it. If you're interested at all, go to taichisystem.com /live workshop registration /. There's more information on that website about the workshop as well. I had a couple questions come up.
Sure.
That,
awesome.
Let me here, and I can go to my questions. One was about arthritis.
Sure.
A couple people, actually, Todd and Elspeth both brought up arthritis.
Sure.
Tai Chi good for arthritis is just, isn't running just hard on people anyway. And Elspeth also asked about if Tai Chi had been researched as far as regenerating cartilage in the knee joint specifically. So I just want to address a couple things, and then I'll let you address it as well.
Sure.
Yes, movement is very good for people with osteoarthritis. Movement and being aware, again, this is where that ABC, if their joints are in alignment, if they have optimal movement patterns, that is going to be great for their arthritis. I am not aware of any peer-reviewed studies that show that doing Tai Chi actually increases knee cartilage or rebuilds knee cartilage. There are some traditional Chinese medicine sites that talk about the possibility of regenerating, rebuilding cartilage, but I don't know of anything that actually proves that. Again, Tai Chi is outstanding. It's very gentle on the joints, and especially if you're aware of keeping those joints in alignment through the alignment, breathing, and control process. Movement, gentle movement with Tai Chi is wonderful for arthritis. What would you say, Dr. Osar?
I would say ditto. I would say everything you said is absolutely true. And what's interesting is I'm literally, just these last few days, I've been working on my next book, the second edition of Corrective Exercise Solutions to Common Hip and Shoulder Dysfunction.
Awesome.
Thank you. And I'm writing this section about osteoarthritis. I've done an osteoarthritis course for the Medical Fitness Education Foundation. I've also done one for PT on the Net about osteoarthritis. So I'm looking at all the research on osteoarthritis. And the only thing that I've seen that actually regenerates cartilage that's been proven are some of the newer, and I should say, I don't even know if it's 100% proven. It's just, there's some positive results from stem cells. It's stem cell injections that help to rebuild the actual cartilage tissues. PRP, plasma-rich protein, has also been shown to be positive for cartilage regeneration. However, there's nothing outside of those two things that have been shown to increase cartilage production. However, as Dianne alluded to, we totally believe that if you put the joint in the best position for loading, as we talked about in the webinar, you give your body the best chance to regenerate cartilage, to load the joint appropriately, because loading the joint appropriately, so if you think about a joint, like just imagine this is your knee joint, the femur and the tibia here. If the femur and tibia aren't aligned very well, you're going to wear that cartilage away on one side of the joint. So if you can align that joint in a better position, which we do through the ABCs and we do through Tai Chi, then when you give your body the best chance for potentially rebuilding cartilage, but hopefully minimizing further degradation or degrading of the cartilage that you do have.
Yes, and it's interesting, as you were talking about the step outs, and you did the step out to the single leg stance. And as I was watching you do that, if anybody has done the Tai Chi with me, I don't know if you saw it as well, but as he went from a step out into a single leg stance, that's really the movement that we call snake creeps pheasant stance. So it's amazing how much even just a corrective exercise comes into that Tai Chi.
That's awesome. And that's why we're so excited to bring this course, because there's so many overlapping concepts. And like I said, I can't wait for it just to learn Tai Chi and just to see the integration of this information into the Tai Chi system.
Yes. There's Lisa has a question. Is capsulitis of the foot caused by improper movement? Do you feel barefoot walking / running is the way to go? I'll let you answer that one.
So it's hard to say. Yes, it can be caused by improper alignment and controls. It can be caused by trauma, and what some of the research is showing now is like a lot of postmenopausal women get joint capsulitis also, and they really don't know why they get it. So will barefoot walking help? It's hard to say specifically without being able to see your foot and know more specifics about your foot. Barefoot walking can help a very rigid foot, especially when you work on the foot tripod and you work on lengthening the foot and widening the foot. If it will specifically help you, I cannot comment on that. However, like I said, in a lot of our patients, we can have them go barefoot to improve their mobility. We can use the tennis ball or use their hands underneath their feet to increase mobility. However, if you've been diagnosed with this, I imagine you've already gone through physical therapy. However, if you have not gone through physical therapy, make sure you have a physical therapist or manual therapist that can take a look at it and help you manage that more specifically. And
it's one of the things in Tai Chi, obviously you can do this exercise barefoot. I encourage people to do especially when they're first starting, I encourage them to wear whatever's most comfortable. I don't, but I eventually want to get them out of their clunky tennis shoes. We have Tai Chi shoes that are very thin so that they can feel the ground better, so they can feel that tripod, so that they can start to connect with the ground with their feet. And that's part of that spreading the feet and all the other pieces to that puzzle. I had a question here. Elaine also asked, Andy asked, I'm sorry. He says, I work with Parkinson's people. Do you have input on dealing with their posture issues? I'm going to answer from a Tai Chi perspective, and then I'll let you answer. Parkinson's, this is one of the, there are many studies, many research studies that are peer-reviewed that prove that Tai Chi is wonderful for people with Parkinson's. Simply even the Chi walking, because we're talking about, this is one of the concepts we'll talk about at the workshop, is substantial and insubstantial, and learning where your weight shift is. And this actually helps them get over that frozen moment when they can't move forward, perhaps. There are many things about Tai Chi that are wonderful for Parkinson's. I'll let you answer if there's other posture things that will help as well.
Yeah, the only thing I'll add to that is the more sort of structure you give clients that have Parkinson's, the more you're able to give them that ability to align, breathe, and control, use those ABCs, and then integrate them into their functional movement patterns or something like Tai Chi, the better off it's going to be for that client. We work with clients that have Parkinson's, MS, many neurological diseases, and we use the exact same approach. Obviously, with individuals that have Parkinson's and MS, especially if they're progressive or when they're progressive, you're limited with how much you can improve and see the outcomes improve session after session, right? If you have a client that don't have those diseases, you're probably going to see, over the course of 6 months or a year, you're going to see a big progression from day one till the end of the year with them. With Parkinson's and MS, you may not see that same progression because of the progression of the disease. However, almost always, and I think you can attest to this as well, Dianne, by the time when the client comes in for that session, and by the time they leave that session, their posture and the movement is evidently, or it's better for sure. You can see evidence that the posture and movement is better, if only for that day. So I would still use everything we've talked about and still cue them the same way. I would still use the same exercises. Like I said, just the progression may not be as great as it will be with somebody without Parkinson's or MS or one of those diseases.
Right. And Vincent wanted to know, he said, unfortunately, he's not going to be able to make the workshop, which I hope that we will be able to see lots of people. Vincent, I'm sorry, we're not going to be able to see you, but he is interested in your programs. Where does he purchase? Where can he get in on your certifications?
So you can go to our website, www.iihfe. So Institute for Integrative Health and Fitness Education, IIHFE. All our certifications and programs, online programs, are all listed on that site as well.
Awesome. We have time. We're a little bit over the hour, but I do want to ask this one last question from Martha. She said, an individual with diabetic amputation of big toe and second toe, how do you create the sense of lengthening and tripod balance?
Yeah, I can't say I've dealt with that. So, however, I would say probably you're going to keep their shoes on to give them that little bit of extra support that they don't have because of the big toe and the second toe. So keep their shoes on in the beginning. Help them still try to find the inside of their foot as much as you can. You can still take a shoe off and do a little bit of that stimulation underneath where the big toe would have been. So the inside arch and across the metatarsal heads there, across the where the toes meet the foot, still do the stimulation and activation around there. However, you're going to help probably do some work in do a lot of work in their shoes just to give them a little bit of extra support because they've lost a lot of that stability that the big toe will have given them. So, like I said, I don't have any personal experience with it to say like, okay, do this and this will work. However, that's the best I can give you as far as recommendations.
And I want to add, I don't have any experience as well. It comes to mind, however, that with the slow movements of Tai Chi, that's going to give the body time to create those neuromuscular connections to help their balance, because they are moving more slowly. And it actually causes the brain to be, what's going on? How can I help this? It gives the brain time to say, okay, I want to be balanced, and the body does want to be balanced. That slower movement is actually very beneficial, I would think. Again, that's just an opinion, but in working the years that I've done Tai Chi, I have seen improvement in balance over and over and over again with people. So I would think that would be a strategy as well.
The last thing I'll say, because it just brought up, I remember I was in a course one time, and this gentleman, he had cut his thumb off, and I forget how he cut his thumb off, and they actually took his big toe, which doesn't sound like a good idea to me, to recreate a thumb.
Really?
So it was kind of interesting because he had mentioned how he kept falling, because he didn't have that big toe anymore for stability. But then he said he did get used to it. His brain, as you're mentioning, Dianne, his brain will adjust to the fact that he doesn't have the big toe and start to learn how to use the inside of the foot. And the best way to create that awareness is to stimulate the rest of the foot as much as you can, even though the person has diabetic neuropathy, but then also that slow movement to create whatever neurological link there still is, because your brain it's still there. It just may not be able to feel the foot, but it still has a link to the bottom of the foot. So the more that you can create that slow and deliberate movement, it can potentially help that individual.
Absolutely. Well, I do want to respect everybody's time. Thank you for allowing us to go just a little bit long. I thank you so much, Dr. Osar, for coming in. This is so valuable that we can be helping clients immediately. We can be helping them long term.
Absolutely.
The marriage of this, the ABCs, the integrative movement system, and Tai Chi is so important as we work with older adults. So if you have questions, you can get to Dr. Osar on his website, which was iihfe.com,
correct?
You can get to me at taichisystem.com. It is Dianne, D-I-A-N-N-E, there's 2 N's, at taichisystem.com. And please take a look at that registration for the workshop. We're so excited for this. It will give you tools. You'll be able to go back that very next week and be impacting your clients' lives in ways that you just didn't imagine that you'd be able to. So thank you again. Thank you everybody for coming. I hope you have a good weekend. Bye-bye.
Thank you. Bye-bye.